Our top story tonight at 6, the Department of Veterans Affairs promised change, but local servicemen say they have yet to see it.
And tonight, several Georgia veterans are expressing their frustration with the VA healthcare system. It was a registered nurse with a heart for veterans who brought this issue to us. And On Your Side's Ken Amaro explains what's bothering them so much.
Correct, Jeannie. The issue is access. The issue is getting a timely response. The issue is a bureaucracy that has left those who serve feeling neglect, with nowhere to turn for help. And in some respects, this registered nurse has now become their voice, albeit limited, with the VA.
I'm not doing real good.
2 months ago, Eugene Martin was in relatively good health.
I can't even put my shoes on.
He suffered burns to the nerves in his feet, and while being treated for his injury, he sustained acute kidney failure.
I need some help.
Now he has ascites. Fluid is building up in his abdomen. He is in constant pain.
And it's a scary thing.
Martin is a Vietnam veteran. He's used the VA healthcare system for the past 16 years, but these days he's frustrated by the VA.
I asked him about putting a port in me, and they said, no, we don't do that.
A port to drain the fluids and to ease his pain.
I feel like I'm third or fourth string sitting on the bench.
He says his biggest complaint is getting access to the system. And Martin says he's not alone.
I speak to a lot of veterans, and all of them say about the same that I say.
Some good news, okay?
Susan Richards, a registered nurse, has seen a number of veterans in southeast Georgia, and she says they're fighting the same fight.
Veterans, one right behind another, just like him, that have different issues.
Richards has become an advocate in some cases, and in some cases, an angel of mercy.
There's no way he can drive to Gainesville, and he's not allowed to get it done here locally because of the rules.
She says it breaks her heart to see veterans struggle to get the help they need and they deserve.
I know the VA is trying to do everything they can. It's just a broken system.
Today, she gave Martin some good news. She was able to get a private doctor to help him. But she says the VA needs to address the needs of the other veterans in her community.
I just don't believe it's fixed. It's still broken.
Now, I provided the names of the veterans to the VA and asked how can these vets get the help they need. I was told if they're eligible and they're having issues, they can follow these 2 steps. First, contact their patient aligned care team or the PAC team. And if that fails, contact the patient advocate's office. Again, Mr. Martin will have his procedure on Friday and will enter hospice care going forward. Back to you.
Ken Amaro, On Your Side.